And I haven't really been doing any.
You haven't been doing
much of
any maintenance?
No. And I feel like now I'm way behind, but I'm like, okay, now I want to really start doing something to take better care of myself, my face.
Yeah.
Obviously, I've got the wrinkles and things like that, so I want to be.
So you've gotten Botox, you've gotten
I've gotten
filler
the
before.
Botox and the.
When was the last time?
You did the.
So that's been a long time.
You did this.
Right.
And then I've only had Botox once.
Okay. And were you
So-
satisfied with the results of that?
Yes. I mean,
Yes.
it's nice. You mentioned that I should get an eyebrow lift the last time we talked. I don't really know much
At
about
some
that, or how
point.
it's, how they work two and two together or whatnot. But I
So
just
what's
wanted
bothering you? Just
the wrinkles.
okay.
I mean, I know that these have always been a thing for me, but
Mhm.
honestly, like, I'm not really too much into like the filling of the lips and
No,
stuff like
you
that.
want to look a natural.
I want to be, very natural looking. I don't want it to be super.
So I'm really bruised right now because I did filler. If you're wondering,
Oh,
if you're
okay.
noticing all these bruises, I did filler. But I like it really natural. So
Yeah.
I don't like that big lip, puffy cheek situation. This is not filler. Actually, it's just a bruise. I gave myself a bruise because I do it on myself. But yeah, I don't like it to look unnatural. I don't like duck lips or anything like that. But
Right.
there's ways to do filler where it doesn't look like it's been done, just to soften some of these folds without giving you that look. But I think that would be helpful.
Yeah.
And then Botox is always fabulous for frown lines, for forehead lines, for crow's feet lines.
Yeah.
And sometimes you get a little bit of lift of the brows.
Mm-hmm.
You just don't always know. You know, the older we get, the less likely it is to lift the brows, because as we age and experience gravity, the brows get heavy and they do start to descend.
Mm-hmm.
So when Botox starts to fall short, an endoscopic brow lift is often a good option,
Okay.
because it's a surgery, but it can get the brows higher, natural looking, and reduce the wrinkles. But the cool thing about the endoscopic brow lift is it never looks overdone. It doesn't look surprised. It always looks natural because there's no skin takeout. It's a minimally invasive procedure.
Yeah, because it doesn't appear to be able to go very far.
Exactly.
You know.
Exactly. It's just a natural reset. So people can't figure out what you've done, which I love, because you don't want it to look like you've had work done, in my opinion.
Yeah.
You want to maintain naturalness. But, that's always something we can consider. Timing is up to you. You can continue with injectables for now, or when you want something a little bit more noticed, or if the injectables fall short, that's when surgery comes into play.
Yeah.
And then once you get the brows up there, you have to see if there's extra skin on the upper eyelid.
Well, that's what I was gonna say. Is I feel like I do have a lot
Yeah.
of skin on my eyelids. I've always thought that. I think it's always been that way, and I think it's just getting a little bit more droopy now that I'm getting older.
Yeah.
But also, even like, I feel like my smile line is like going down
It
versus
does.
up.
Mhm.
I'm like, how do you fix
So I think
that?
filler would be nice to kind of help the corners of the mouth and that marionette depression. And then for the eyes, skin takeout is called blepharoplasty, where we make an incision in the upper eyelid crease and we remove that extra skin. And that helps, especially if you're putting like makeup on, it won't crease as much.
Yeah.
It won't be as heavy. But you always have to look at the brows when you're assessing the upper eyelids, because a lot of people don't realize that the brows play such a big role in the way the upper eyelid skin looks. Because if the brows are low, it makes it look like there's so much skin there.
Right.
But the reality of the situation is, sometimes the brows need to come up and there's not as much skin as you think.
Gotcha.
But often we'll do it in combination, because when we do facial surgery, it's never meant to last forever, because you keep aging, right? And so you don't want to do like something and have to come back and, I wish I would have taken skin out at the same time. So it's a nice combination to do both together sometimes. But let's do an exam and we'll go from there.
Okay.